It is President Barack Obama's signature achievement, but it doesn't work. Healthcare.gov, a website set up so Americans can sign up for Obamacare, is lost in cyberspace, and now lawmakers want to know why. Eber's Kyle Schmoyer joins us live from the nation's capital with more on this very fiery hearing. Kyle.
Well, Logan, the website, healthcare enrollment, and the Obama administration's handling of it were all, in essence, on trial today for the first time here on Capitol Hill. And at the end of the proceedings, the chairman of this particular oversight committee said there were a lot of good questions, not enough answers.
This is not about blame. It's about accountability, transparency, and fairness for the American public. The broken promises are many.
With that, the House Energy and Commerce Committee was off and running with a hearing on the federal government's troubled health care website.
We were promised a website where people could easily compare plans and costs. $500 million later, we find the American public have been dumped with the ultimate cash for clunkers.
During opening statements by the committee, most Republicans were very critical and skeptical about the healthcare.gov rollout. Not a surprise to regular Capitol Hill observers.
This is just going to be the start of oversight hearing after oversight hearing after oversight hearing, because now that the government shutdown is behind us, you can look to see this be a primary thing for the Republican brand, is to kind of keep on this.
First up before this committee, the lead contractors responsible for setting up the healthcare website.
The system will continue to improve. From our perspective, it's as painful as it sounds. I know that the experience has been a difficult experience. The system is working. People are enrolling, but people will be able to enroll at a faster pace. The experience will be improved as they go forward.
At one point, California Democrat Congressman Henry Waxman asked how long the fix would take.
We anticipate that the system, as we have seen, is improving day over day, and that we anticipate that people will be able to enroll in the time frame allotted that's necessary for them to have insurance as for the January 1 time frame.
As expected, today's testimony didn't provide any real smoking guns as to what or who is responsible for the website failures.
I don't think you're going to get a lot of these big reveals in any sort of public setting right now. I think that there's nothing really to be gained from being too specific about what the problems are until you've gone and solved them.
But that didn't stop some Republican members from making interesting allegations during the hearing.
You're telling every American, if you sign up for this or even attempt to, you have no reasonable expectation of privacy. That is a direct contradiction to HIPAA, and you know it.
Now, that particular statement there, not 100% accurate and factual. It was corrected by those healthcare contractors in the hearing after that. But make no mistake, Logan, today's hearing alone, day one, very contentious, back and forth, but not mostly between the questioners and those answering, but actually among the questioners themselves.
And exactly, Kyle, you don't have to be partisan to realize that healthcare.gov doesn't work, or at least it doesn't work like it's supposed to. But it did get very partisan on the floor, with members of the House basically bickering with one another. Tell us about that a little bit.
Yeah, it was an interesting moment right there in the middle of today's hearing. What you had was the congressman from Michigan, the actual chairman of this particular committee, Fred Upton, kind of getting into an argument with the Democrat congressman from New Jersey, Frank Pallone. I want you to take a look at this and listen to this confrontation we heard earlier today.
So once again, here we have my Republican colleagues trying to scare everybody.
Will the gentleman yield?
No, I will not yield to this monkey court or whatever this thing is.
This is not a monkey court.
Do whatever you want. I'm not yielding. I am trying to tell you that the problem here,
protecting American citizens,
there are no pre-existing conditions.
Legitimate concern of this committee.
The pre-existing conditions don't matter. HIPAA doesn't apply. There's no health information in the process. You're asked about your address, your date of birth. You're not asked health information. So why are we going down this path? Because you are trying to scare people so they don't apply.
And there you have it. That was just a little bit of a snippet. Yes, we heard the phrase monkey court inside the halls of Capitol Hill today on this, but very contentious back and forth. A lot of allegations flying back and forth, but one factual piece of information we got today, that actually came from the Center for Medicare and Medicaid Services. We learned from them today, and actually we get a number, 700,000 people. That is the number given out today for the number of people who have applied for health insurance either through the state or federal exchange programs. We're learning that. We're also hearing from the Obama administration, Logan, that we should continue to get regular updates from that Center for Medicaid and Medicare, and also from the Department of Health and Human Services as this goes forward, because as you can see, there's a lot of confusion, and at least today's committee hearing alone didn't do a lot to clear it up.
And of course, the people who are stuck in the middle are those people who are desperate for health insurance but can't otherwise afford it or get it. Kyle Schmoyer reporting live in the nation's capital. Thanks so much for your report tonight.